I am incredibly honored to have this opportunity to be able to share with all of you my journey into infection prevention. I am an infection preventionist. I have a significant passion in trying to take every opportunity I can to educate people on what it is that infection preventionists do and what we are, because so many people just don't really know that this wonderful profession is out there. So, what you may or may not know, infection prevention is generally a new profession, only being brought into healthcare about 50 to 60 years ago. And the role has really evolved over time and really still was evolving at the time that I entered it. It's a profession of persons from variable backgrounds. In particular, for me, it's nursing, but there also are people who have a background in microbiology, a medical technologists, even public health professionals. And essentially, we meet the competency requirements for the basic knowledge of the prevention of infection. Some in healthcare facilities, more and more now we're seeing people across the continuum of care. And even more so now, we've seen some infection preventionists on cruise ships in light of what happened last year. So that might be my next journey, I think, after COVID, of course. So, as you know, I am a nurse by training and really would just love to take you on a journey as I reflect on how I came to be working in the middle of a pandemic with the facility response. So, in 1995, which seems for me like forever ago, I graduated with my associate's degree in applied science and nursing from Mohawk Valley Community College. I've been a local, stayed local for most of my career, if not all of my career. And after graduating from my associate's degree, I worked as a bedside nurse up until through 2001, most of which being in critical care nursing. In 2000 and, or no, I'm sorry, in 1997, I started my Bachelor of Science degree program at SUNY Poly, which at that time was called the SUNY Institute of Technology. I did graduate in 2001. And, I've really, when I was asked to do this presentation, I really wanted to reflect on my education at SUNY because I really feel like my experiences there laid the foundation for what I do today, although I did not know that, not for 1 second at the time. So I just want to explain that for a little bit. So for instance, my coursework really included exposure to the theoretical basis of professional nursing practice, comprehensive health assessment. It introduced me to nursing research and evidence-based practice, which has since then become my love, and really exposed me at the time to public health through clinical rotations with the local health departments. And I also had an opportunity to spend some time with a school-based health program where the school nurse was actually also a health educator. And I spent a great deal of time with her. I remember when I was at SUNY, we were assigned to do a windshield assessment. And I had to drive around and assess my community. And I remember learning so much about the community that I was living in, just essentially paying attention to my surroundings. And really, this was the first introduction that I had to the assessment and interventions of populations and population health. And not just really focusing on the single person. And certainly looking back and reflecting on that journey, I can appreciate so much now how SUNY laid that foundation for me to explore population health throughout my career. So when I was at SUNY, little did I know there were a lot of things happening around me in the world that would carve my path that I wasn't even aware of would have an impact on me professionally moving forward. And so I wanted to share a little bit of that with you. In 1999, the Strategic National Stockpile was introduced by of having in the Soviet Union having anthrax and smallpox accumulated, and at the same time they also established the Laboratory Response Network that would be a network of laboratories that would respond to biological and chemical threats in public health emergencies. Now, that was in 1999, but this kind of just spreads out over a few years beyond that. My cat's trying to jump up on my desk, so that's not good. Okay. So let's go to 2001. And in the aftermath of 9/11, the New York State proposed that we have community preparedness and have an effective emergency response plan system in place. And this really became a priority. And it really pulled the Department of Health into that emergency preparedness role and really forced those health departments to work with healthcare facilities with a plan that over the next 5 years, or that within the end of 5 years, which would have been 2008, that people in New York State would live in a population in an area where there was an approved emergency preparedness plan for 100% of the population. That forced local health departments over the next several years to partner with healthcare and develop an emergency response plan that included isolation and quarantine, pandemic response, and the national stockpile. So I'm sure much of this is starting to remind you of our past year during 2020. And so that really did set the stage for the next several years of my career journey as an infection preventionist in New York State. At the same time, funding was allotted to many of the hospitals to accomplish those plans. And there were specific deliverables that we all had to meet in order to keep that funding in place. And so in 2003, I actually was approached by my director of nursing, and I was asked to be the infection control coordinator at the time. That was what they called us then, for the organization. Honestly, I said no right away. I did not want to be that nurse that everybody ran away from when I arrived up on the unit. And so she kept approaching me, and she finally talked me into trying it out. So that very first day, I started working, and I got a call from the medical surgical department that said they had a scabies exposure. And I didn't have a clue what I was doing. I researched about scabies and with the transmission of the scabies and what were the interventions to prevent scabies exposures and scabies outbreaks in hospitals. And I honestly spent probably way more time than I needed to in my office making sure I knew the answers, and then finally went back to the floor, and we instituted our plan for exposure contact tracing and infection prevention. Honestly, needless to say, from that very day, I loved infection prevention, and I have learned something new every single day since then. At the same time, in 2003, you may or may not remember, there was a SARS outbreak. That was a severe acute respiratory syndrome. It was a novel coronavirus, the same type of coronavirus that we're seeing in 2020. And, I jumped right in as an infection preventionist. And if you remember, we were developing these plans because we were, as a hospital, required to do so. And this was my first experience with preparing for and navigating the guidance for a national emergency, if you will. First, developing surveillance, clinical and laboratory evaluation, and reporting for this disease outbreak. Thankfully, we didn't see any cases at the time, and I thought, well, I learned a lot during that. That was really great. Let's move on. And so I proceeded to develop an emergency response plan for the facility I was working with at the time. And that included a pandemic plan and a point of dispensing plan. And I learned a really lot in a very little amount of time about pandemic preparedness. Much of my first years in infection prevention was preparing for a pandemic, and that's what I learned. Um, One of the things that I wanted to bring up to you is that novel corona outbreak in 2003 was very scary for many, many people. And when we look at the total numbers, the CDC estimated that pandemic estimated to have affected 8,098 people worldwide and a total of 774 deaths and 8 cases in the US. And, you know, when I think about what we've been through over the past year and how I felt about that scary disease in 2003, what a vast difference in numbers, right? I was scared then. And so that brought me to 2005. And George W. Bush signed into law in 2005 the Public Readiness and Emergency provided like somewhere along the lines of $3.8 billion for pandemic influenza preparedness, and just to prepare us all for the possibility of a pandemic disease outbreak. And this act resulted in a cascade of events for me and my role as an IP. At the same time, now this was a small rural hospital that I was working at. And part of those funding deliverables was to put in a position within your hospital to have a bioterrorism coordinator. And so then the director of nursing came to me and said, hey, how about being our bioterrorism coordinator at the same time that you're our infection preventionist? And I thought, well, okay, because I kind of was already doing it anyway, and took that added responsibility on. Again, it was a grant funded position to help us prepare for emergencies. And I quickly became trained in incident command systems, hazmat response training, and all hazards emergency response. Over the next 3 years, I learned the roles of emergency management, infection prevention. I became certified in incident command systems, hazmat training, and infection control and epidemiology. And it was during that time that I was able to drill our point of dispensing plans, which are pod plans. And so you may or may not know that that's what those vaccination clinics for COVID are called. These were intended to be able to deploy mass vaccinations or even just medication that needed to be given prophylactically for a particular disease of concern in a rapid and efficient way. And I did these drills every single year. In 2006, the Tdap vaccination was introduced, and all healthcare workers were recommended to get that. So we were able to practice our pod with the administration of the Tdap vaccine. And then we also did that with the influenza vaccine on an annual basis. And at that small facility, we were vaccinating hundreds of people in one day. On an annual basis against influenza. And the most important piece of that was that we were able to refine our process every single year doing that exercise and make sure that we were able to find opportunities for improvement and improve our plans moving forward. It was also in 2005 that I joined APIC. APIC is the Association for Infection Control and Epidemiology. So that's the place for all things infection prevention. And there are a lot of resources there. And it allowed me to network with a lot of other professionals that were embarking in the same career as myself. And so that was really an important stepping stone for me in my career journey. In 2008, I had a colleague call me up and say, hey, would you be interested in a position at a larger hospital, being a manager of an infection prevention program and having working with other infection preventionists? Now at that small rural hospital I was at, I was the only IP. And so having a team really did appeal to me because I didn't know everything and I always needed to have somebody around me to ask questions for. And I thought that would be a really great stepping stone for me in my career. And so I took the risk. I really felt at that time very confident in my infection control abilities, but I wasn't so sure about being a manager because I really hadn't had many opportunities to do that. I was a charge extent of my supervisory experience, but I did take the jump and I took the job, and I was lucky enough to work for an organization who provided me with the training and resources to be an effective manager over time. And believe me, there were some bumps in the road for that. In 2009, we had the H1N1 influenza virus. And honestly, there was this was scary for me. This was the real deal. And we were dusting off all of our preparedness plans, and we were developing surveillance protocols and definitions for the disease, really doing triage screening at the doors. We were looking at our personal protective equipment management plan, educating on how to use personal protective equipment, really making sure that patients were isolated rapidly and quickly. And we broke out our stockpiles of personal protective equipment and medications. And we really had that opportunity to act on all of the guidance documents. There were a lot of people that got very sick from that H1N1 influenza. There were a lot of people that died, unfortunately, from that influenza. And I felt like, oh, that was the real thing. And I remember thinking at the time, well, I hope I never have to go through that again. And what their estimates from CDC were that there were about 60 million cases or during the first year of H1N1 and over 12,000 deaths in the US. And as of March of 2021, the US total for COVID cases is well over 29 million and 531,000 deaths already. So at the time, I thought that was the biggest thing I'd ever have to go through. But you can see on this is really probably not very easy for you guys to see, but that's a really nice map comparing those two pandemics, the COVID-19 and the H1N1. And the numbers are significantly different when you take a look at those in detail. So putting that on a comparison scale is really important for me to see, hey, going through that journey, at the time, I thought it was the biggest thing I'd ever have to go through. So in 2012, the organization that I was working with had plans to combine themselves with another hospital system, developing a health system that would consist of 2 acute care hospitals and a long-term care facility. I was really, really worried that I would not get the job because there was obviously another person at the other campus. And I thought at the time that there was a possibility that if they merged these 2 positions into one as the manager or director of infection prevention, that I wouldn't get the job. And the reason being, I mean, I had more experience than the other person over there, but she had a master's degree and I did not. So I had my bachelor's degree. I had a lot of experience. I thought I had a good chance, but I wasn't really sure. And I had been waffling over going back to school again. I had tried the nurse practitioner track. That wasn't really for me. I tried the education track. That really wasn't for me either. And so I was just kind of in this holding pattern at the time. And it was during that same year that I had heard about Loyola University, and they had infection prevention programs there. And I called there and they told me about their Doctor of Nursing Practice program. Just for history, my mother has her Doctor of Nursing Science, and she would always say to me, "You got to get your doctorate, you got to get your doctorate." I was getting kind of old, and I was like, I don't know. And so when this opportunity came up and a little bit of pressure for my career, I thought, oh, okay, here it is. This is it. This is what I was born to do. This is what I need to go. And so I knew this is what I wanted. I felt very strongly that it would be a compilation of my journey from my first introduction to evidence-based practice and nursing research at SUNY through my practice experience as an IP, tracking and preventing healthcare associated infections, and being involved in outbreak response. I felt like that was the natural next step for me. So in August of 2012, I started the program. It was a bridge program that allowed you to get a DNP over a 4-year period of time. I went for 3 semesters per year for 4 years. I worked full time and raised 2 children, and I graduated in 2016. Most of it was remote. I stayed at home and did it. So I'd work full time during the day and I'd go to school full time at night. And during that time, from an infection prevention standpoint, there were some threats of outbreaks and pandemics, and that, made us dust off our plans and practice responding to emergencies. And every year we still continue to practice our drills and educate our staff so that we were basically prepared for an emergency. So in 2014, Ebola hit. And so that was a huge one for us in the hospital. It's really, really scary because although you actually had to come into contact with blood and body fluids to actually acquire the disease, the concern for more mortality with this particular disease was very real, that if you did come into contact, you probably would die. So there was a tremendous focus for us to educate on proper personal protective equipment, donning and doffing practices. And once again, we dusted off all our protocols, and really we had to make new policies and procedures because most of the things that we had been planning for up until that time were respiratory diseases, not an Ebola-like disease. So, and also in 2014 was the year that the 2 hospitals did come together and they did merge the position. And I was awarded the Director of Infection Prevention for the whole health system. And it went very smoothly. The other person didn't want to do that anyway, so it was really pretty good. So that went pretty smoothly. So now I found myself in 2014, the Director of Infection Prevention for a fairly large health system. And in 2016, I graduated from Loyola University with my DNP. I also at that time became a member of APIC's Professional Development Committee. As I mentioned in the beginning, I am super passionate about professional development. And through my coursework with Loyola, I developed a professional performance development program for the IPs in my organization that encompassed a career ladder because infection preventionists generally don't have anywhere to grow except out of the office. So once they become really good, then they go find bigger and better jobs. So my whole project was to develop a career ladder that would, as they increase their competency base and knowledge, would also award them higher pay and also a higher level of practice within the organization and recognition for that. In 2017, I was awarded the Fellow of APIC. And so I am currently a Fellow of the Association for Professionals in Infection Control. And in 2018 and 2019, I did publish in the American Journal of Infection Control on the topics of professional development and also infection prevention in hemodialysis settings. And I have been honored to be able to present on various topics at the annual APIC conferences over the years. I was really putting myself out there, and I think it's really important to do that. Putting yourself outside of your comfort zone networking, because when you work, you have a value in what you do, and the work that you do is so important. And when you start networking with other people, they recognize the work that you do, and then people start to make recommendations for you to go do something else. So finally, here we are in 2020, last year. I was elected the committee chair to APEC's Professional Development Committee at that time. This was an unusual year for us because we have been working on the competency model for infection prevention. So we really started to work on professional development opportunities for infection preventionists during COVID, or during pandemics, if you will. Meanwhile, in my organization, it was COVID, COVID, COVID. And, right towards the end of 2019 and 2020, we were dusting off our plans and making sure that everything was all in place. And, I kind of in the back of my head thought, oh, this is going to be the same type of thing that happened before. We'll get all planned up, and I get all adrenaline rushed into it. We get all ready, and then we might have a trickle here, a trickle there, or just a simple scare, maybe somebody who we thought might have COVID who ended up not having COVID. Well, but boy, was I wrong. And so starting in March, we got slammed with COVID, and it honestly really lasted all the way up until the summer. We had really taken a lot of time on, again, proper donning and doffing education of personal protective equipment, because you remember the 2003 coronavirus outbreak that I mentioned. The research done on that had found that many of the people that were affected were healthcare workers, and simply because they were putting on and taking off their PPE improperly. So that quickly became a priority for us before we even had any COVID to begin with. The whole COVID experience was very challenging because this was a brand new disease that we didn't really know much about. We had assumptions because of prior coronavirus outbreaks, but the guidance was changing so rapidly that we were finding ourselves redoing work that we had done in a different way. But again, we implemented our emergency plans, we implemented symptom and temperature checks, our masking mandates, surge planning, and again, as I'd said, we'd really gotten slammed. Now, what was really interesting to me is all of those things were addressed in my pandemic plan way back in 2003 and 2005, but we never really got to a masking mandate. We never really got to implement all of the pieces and parts in my pandemic plan. So it was really kind of fun to see it all come to fruition and come full circle. So during this time, I was feeling within my soul that I wanted to do bigger and better things. And I really wanted to help on a grander scale. And I was offered a temporary position with the CDC Foundation, working with the New York State Department of Health during their COVID response. And I would be responsible for New York State Article 28 facilities, which is really nursing homes and hospitals, and helping them with their COVID response. This was a really big risk for me because I was kind of in a good place. I had a pretty good career. I could probably stayed at the facility for a long time and probably retired from there. But I really felt like I wanted to use my experience on a grander scale. I decided to take the risk. And even though I knew it was temporary, I felt pretty strongly, honestly, that I probably would be able to find a job after all this was over with. And also, there was a lot of attention coming to infection prevention. So I felt like when and if this temporary job ended, that there would be a need for infection preventionists and the opportunities would not be limited. And so I took the leap and I went for it. And so I started working with the New York State Department of Health on August 3rd, 2020. And I was assigned to the metropolitan region which is the Hudson Valley and New York City region, excluding Queens. And this was a hot spot at the time. And boy, did I learn a lot. I hit the ground running, jumped right in. I knew a lot about COVID, so I didn't have to learn about the ins and outs of PPE and the ins and outs of implementation and intervention. And so what did I do? I developed relationships first and foremost with those organizations. And and we followed up with every single nursing home or hospital who reported a nosocomial COVID transmission. And some facilities had rather large outbreaks, some had not so large outbreaks, but I called facilities all day long. We provided guidance to facilities. I spoke to them and helped them navigate the guidance. And we did some virtual tours because we couldn't get out to everybody. We did on-site visits, and we did virtual tours using FaceTime and WhatsApp, where a facility would do a video tour and show me all of their infection control practices, and then I would make recommendations to them. I then, in the middle or late fall, the activity began to pick up around the state, and I was then deployed to the central region. I actually live in central New York, so that was a little more convenient for me, and have been working with nursing homes and hospitals in the central region since somewhere around December 15th. And I absolutely love my job. I love the relationships that I have developed with people. I feel like I am helping and fulfilling my goal, at which I thought in the very beginning that I would be able to help a lot more facilities rather than just one. And I am absolutely feeling like this public health arena is the place for me, at least for now. But do we ever know? I mean, obviously, way back in 2001, 2003, I never thought I would be an infection preventionist. I never knew. You really just never know where you will end up. And there was a force that pulled me in that direction with a lot of hard work and perseverance. I am really proud to say right now that I have become a national leader in infection prevention. And I dare not say that the buck stops here. I truly do believe that there will be another piece of this journey that I'll embark upon one day that will be as fulfilling and add as much value to the experiences that I've already had. If there's one thing that I can say to you is just keep your doors open and take opportunities where they lay, and always consider taking a risk. This is a temporary job for me, so if you're wondering if I'm going to keep on going right now, I am going to stay with the CDC Foundation, New York State Department of Health, and most likely will end up staying with the Department of Health when my contract ends for the CDC Foundation. So thank you so much for listening to my journey, and I hope in some way inspires you to take some risk and just be open to different opportunities that you may not have embarked upon on your initial career journey.